Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 and infection control related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communication specialist with Quality Insights. Today's webinar is Ventilation in Healthcare. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them in the chat using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic will be a live Q&A on enhanced barrier precautions. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guests today, Elizabeth Dowk and Cindy Holmes. Elizabeth is the Director of Infection Prevention for the West Virginia Department of Health's Office of Epidemiology and Prevention Services Healthcare Associated Infection and Antimicrobial Resistance Program. She has 22 years of valuable nursing experience, of which 13 years were in the acute setting as a clinical nurse, then 9 years as an infection preventionist in the post-acute long-term care setting at the center, regional, and corporate levels. She also has infection prevention experience in a large hospital system. She is certified in infection control and long-term care certified in infection prevention by the Certification Board of Infection Control and Epidemiology and serves as a member of their test committee. Elizabeth is also a member of the Association for Professionals in Infection Control and Epidemiology and is a board member for the 2023 West Virginia chapter. Elizabeth has received the CAMC Nurse Excellence Award in 2014, as well as the McKnight's Women of Distinction and Veteran VIP Award in 2022. Also joining us is Cindy Holmes. Cindy is a registered nurse with over 40 years of experience. Her work experience includes direct patient care in various settings in acute care hospitals and director of surgical services. Cindy has also worked as a consultant to prepare hospitals for regulatory surveys. Her most recent position in the acute care setting was as director of quality management and infection prevention in a long-term acute care hospital. Cindy is currently employed as National Health Safety Network epidemiologist for the West Virginia Department of Health, Bureau of Public Health's Office of Epidemiology and Prevention Services. She is responsible for the analysis of infection control assessment data, as well as data from the National Healthcare Safety Network for West Virginia from a variety of healthcare facilities, including hospitals and long-term care facilities. Elizabeth and Cindy, thank you for joining us again today. And I will be sharing the presentation on my screen today, so let me get that pulled up here in just a moment.
Thank you guys for having us. Hi, everybody. I want to start off by first introducing, for you in West Virginia, we have two new IPs with us that will be coming into your facilities. Their names are Lauren Craig and Amanda Davis. And they tell me they're somewhere watching this now. So if they've got their videos on or whatever, give a little wave. And then we'll go ahead and start on our talk about ventilation in healthcare settings.
Are you able to see just the PowerPoint right now, Elizabeth?
Yes, ma'am.
Thank you.
Okay, next slide, please. So we're going to talk about what ventilation is, how it works, and why it matters for infection control, and how we use it. So next slide, please. These are our learning objectives, and we hope that by the end of today's training that you'll be able to describe why good ventilation is important for infection control in healthcare, like I said a second ago, how ventilation works, to reduce germs in the air, and why it's important to work with the people in your facility who are in charge of air handling and ventilation. Next slide, please. But first, let's think about ventilation outside of healthcare. How does ventilation play a role in our lives? If you can think of any examples about ventilation, then go ahead and drop them in the chat. Some examples that we're going to use are opening windows in your house. It's a great time of year for that, spring cleaning, get that fresh smell. But also if you burn something in the kitchen and the smoke detector goes off, you pull the air in to push the bat out. Rolling down the windows in the car. As a mother of 3 boys and a husband, I will tell you my windows get rolled down often. But again, getting the bad smell out and the fresh air in. Hood vents over stoves or your dryer vents. And that is removing air from a space and replacing it with other air. Next slide, please. Oh, sorry. I apologize. Go back one. Okay. So in order for us to understand ventilation a little better, let's look at the definition. I've kind of given you a heads up on it, but it's the movement of air in and out of an enclosed space. So for example, the circulation of fresh air to a room or a building. To further explain in better words than I use, we're going to listen to Dr. Abby Carlson tell us what ventilation is. Do you care to cue a video? Do you have it? It should be the EP17. Great, thank you.
Welcome back, everyone, to Inside Infection Control.
Sorry, were you able to hear that? I forgot to click the box to share the sound. You were?
I can hear it.
Okay.
Our video blog here at CDC's Project First Line. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's wonderful to have you back with us here today. Many of us have been hearing about how important ventilation is, but you might be asking, what is ventilation and why does it matter? Ventilation essentially is the movement of air in and out of spaces. It's important to understand because good ventilation can help move things that we don't want to breathe in, like virus, out of the air. That's why it's important to have the best possible air movement and air quality in healthcare. It can help reduce the risk that germs will spread, particularly the ones that cause COVID-19. But how? Well, remember that we talked in another episode about our respiratory droplets and how some of them can move and float in the air for a while. Many of them are going to drop to the ground or land on surfaces pretty quickly, but what about the ones that don't? What about those that stay in the air? What happens to them? Well, in the outdoors, they get carried away pretty quickly. They're outdoors. They could also be killed, like by sunlight or by drying out, so they can't make you sick anymore. You can think of it like this. Let's imagine that respiratory droplets are like droplets of food coloring. Now let's imagine that we drop a little bit of that food coloring in the ocean. You wouldn't actually do this, of course, but picture it in your head. You're dropping a little bit of droplets, just like you're breathing out some droplets if you're infected with COVID-19. It's so little and it gets carried away so quickly in the ocean that the ocean doesn't turn a different color and you can barely see where the food coloring was for more than a few seconds. That's like those respiratory droplets being breathed out outside. The droplets are very quickly carried away and you don't worry about breathing them in because they spread so fast and essentially disappear. On the other hand, if you put that drop of food coloring in a glass jar of water, one that's filled with water and isn't moving, so the water is not coming into the jar, it's not coming out of the jar, it's just sitting there, you'll see that food coloring when you drop it in, and the whole jar is going to turn a color. That jar is like a room without ventilation. Just like the food coloring in the jar, when somebody who's infected with COVID-19 breathes out into a room, that virus that's being carried by those respiratory droplets are going to stay for a little while and won't have anywhere to move. But imagine we now take this jar and we put a system together that takes out old water, the colored water that the food coloring is in, and puts in new water. Then what? Slowly, depending on how fast the new water comes in and how fast we take that old water out, that color is going to go away. And eventually, we'll have nice, clean water again. It's the same thing with ventilation. When old air with droplets is pulled out and new clean air is pushed in, eventually we have nice clean air in the room. But what if you don't have a system that's moving air like that? What can you do then? Well, in those cases, you may see that rooms are going to be cleaned by a filter instead, like a HEPA filter that is put in a corner. So you don't change the air in the room, but you're just trying to clear it of those respiratory droplets. Almost as if we were to drop something in the jar that pulled all the food coloring out of the water and cleaned it up again. You can see how doing these things to improve the air and the movement of the air will help keep the virus from spreading. The fewer virus particles in the air, the less likely you are to breathe them in, or that they'll land on your eyes or a surface that you might touch. So, ventilation is important, and it's one of the many tools that we have to keep infections like COVID-19 from spreading. As always, thanks for joining us. Be sure to follow up with us on Facebook, Twitter, and YouTube, or you can check us out on our website, cdc.gov/Project Firstline, and we will see you back here with the next episode.
Now, would you like to watch the other video or move back to the PowerPoint?
Go back to the PowerPoint.
Okay.
How does ventilation work? Okay, so Abby, Dr. Carlson, did a very good job giving us an image of ventilation, how it works, or sorry, what it is. The next slide is going to show you how it works. So go ahead and, so I don't know if you can click on that and get the animation to work. No. It's
No,
okay.
it took me to another website. I might be able to hunt it down though.
It's okay. I can explain it. So if you look, okay, so if you look at the arrows, there's green arrows on the top right and there's red arrows on the top left. So when there's no ventilation in the room, the respiratory droplets that a person breathes out, which would be represented by the red arrows, will spread into the space because they don't have anywhere else to go. So looking at this picture, the room with the person in it will just fill up with red arrows, which virtually would be viruses that we could breathe in or things that we could get on our skin and such. So when you add ventilation, which is clean air coming from the outside source in the green arrows, it's pumped into the room, and then you have the red arrows that are being sucked out of the room into the outside to displace the, I call it dirty air with clean air. And that diagram shows you what she was explaining, where you put clean in, take the dirty out, and the viruses go with it. Okay, let me get back to my, I didn't count on having to explain that. Okay, so does anyone have any questions about this ventilation, this diagram? You can put it in the chat. I don't know if you can unmute yourself or not. But I think you get the concept.
You can raise your hand if you would like to request to be unmuted to ask your question.
Okay, next slide, please. So let's spend some time talking about why ventilation matters in our workplace and what we can do about it. So I'm going to lean on Dr. Abby to discuss this, and then we'll dig into it just a little bit further.
Welcome back, everyone, to Inside Infection Control, our video series here at CDC's Project Firstline. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's wonderful to have you here today with us. We talked in an earlier episode about what ventilation is, the movement of air in and out of spaces. But Now, let's talk about why it matters and what you can do about it. Let's talk first about air in healthcare. Having clean air in healthcare can help reduce the risk of germs, particularly that of COVID-19, from spreading among patients and among your coworkers. You may not know this unless you're part of your maintenance staff or you work on air systems in your building, but nearly every room in a healthcare facility has a recommended number of air exchanges. An air exchange is the time that it takes for a room's old air to be completely replaced or nearly completely replaced with new air. We usually measure it by the hour, so we think about how many times per hour the air in the room is replaced. It's complicated, and it's a lot more than most of us need to be experts on. Even I have the basic principles, and then I talk to the experts about a lot of the complex stuff. But it's important to know how often the air in that room is being exchanged or cleared. And that will tell you how long the room should sit after a person leaves and before another person can come in without a respirator or other PPE. It's really important to note that we're talking about entering without PPE. You can enter the room with your PPE before the air has exchanged and, of course, while the patient is still in there. But without PPE, the wait time is important, and that's something that we recommend to wait for before you go in. You can always talk to your building's engineering or maintenance staff to find out more, or the people who deal with your heating and cooling systems. Even before COVID-19, these recommendations were in place for air exchanges because it's that important to make sure that air is reasonably clean and moves in and out of rooms. One good way to check if there's ventilation of any sort happening is to look for vents and fans, just like you would in a house, see where heating and cooling is coming from. There are some simple things that you could also do to increase ventilation. So, for example, if somebody's microwaving fish in the break room, what do? Well, you open a window, you turn on a fan, or you avoid the area until the smell has gone away. The air has been exchanged. But in healthcare, things like opening a window or changing the fan in the room can change the balance of air across a lot of different spaces. So one room is affected by another, And that's why it's important to work with the people at your facility who are in charge of air handling and ventilation, and not to do things on your own, so that you don't affect air movement in the wrong way. So, ventilation is important in healthcare, and it's one of many strategies for keeping germs from spreading. And you should use it as much as you can to keep that air clean. Thanks again, as always, for joining us. Please be sure to follow up on Facebook, on Twitter.
Okay. I like using Dr. Abby because she explains very well, and most of you know that I don't like to present, so I think I like her words better than mine. So she gave a lot of information there, and a couple of things I really want to point out is, and if you reflect on your own practices in your own facilities, how many times does it get like really hot in an area and people open the windows and to cool down the area, and then maintenance comes out and says you can't open the windows because it messes with the heating and cooling system and it doesn't work properly. So essentially opening the windows makes it harder to get the temperature under control. That's one example I was thinking about. Other examples and additional information can be found. Cindy's going to put a link to the CDC Environmental Infection Prevention and Control, and it talks about air changes and gives you information of how many air changes you need to remove certain particles in your room. If you don't know your air changes, you need to get with your maintenance people and find out. There are ways to calculate that, and the CDC also has information on that link also. But you need to, discuss it with your maintenance people and your get the information from your building representatives. Next slide, please. Okay, so let's review. Go ahead and pass that slide to steps to support good ventilation. Sorry. Next slide. Okay, so let's review. Steps to support the good ventilation is that we need to know how long it takes to clear the air in certain areas, such as patient rooms. Right now, measles are among us, and they are also spread by air. As you know, tuberculosis and COVID. So these are things that if we know ahead of time, then we can prevent problems from occurring. We need to make sure that if staff, visitors, or patients are entering a room, that if they're entering the room before that time frame, that they need to wear the appropriate PPE to protect themselves from those viruses in the air. And again, don't take action on your own. Make sure you include your building manager, your maintenance, your leadership in any decisions or thoughts that you have. And then if you have any questions, then we suggest that you consult a professional with ventilation and experience in HVAC type industries. And remember, if you open a window or a door or something to make the environment cooler, then you could be changing the dynamics of the whole system and making it a lot harder on the system itself. Okay, so I went rogue like I usually do at the very end. So let's have a little bit of reflection over what we've talked about. Does anyone have any questions or comments? Any examples they want to share with the group that might be handy? Next slide, please. Oh, I just see the numbers going up in the chat. Okay, next slide, please. So this is a handout that is available. Cindy will also put the link to it in the chat. And these are speaking points, talking points that you can use to discuss with maintenance and your leadership and remind you of things with ventilation. If there's no more questions, I just want to say that I hope this training has helped some of you, or at least sparked the thought process and conversation of ventilation in your facilities. The ventilation. So in long-term care, everything that we've discussed as far is applicable to long-term care, all healthcare settings. But you would need to discuss with your maintenance, your property managers, your leadership for your specific facility. There's not a fix for every facility because they're not all the same. It depends on the layout of your facilities. It has a lot to do with your HVAC systems. Of course, it has a lot to do with, what your facility is at risk for. So I'd be more than happy to discuss this more on a one-on-one with you if you need to. Cindy's also going to put our contact information in. And then this can also be something that during your ICAR that we conduct, that we can discuss further with you as well. Okay, next slide, please. Are there any additional questions in the chat, or is it all Cindy and?
Let's see. Do you mind if I stop sharing for a second?
Yeah. Oh, you're fine.
All right. Well, I was going to say, I was looking, I just, as I was screen sharing, I wasn't able to keep an eye on the chat, but some of the things that Cindy put in, I think you just shared those with the hosts and panelists. So I'm not sure if everybody could see them. So I'm going to reshare those resources that you were dropping in the chat, Cindy.
Okay. Okay.
And then while we're waiting, I'd like to invite, sorry, let me just go ahead and put those in real quick.
I'll just take a minute to say, I did put a link in there for Project First Line. That's where you will find more videos from Dr. Abby Carlson, along with our slide show that we used is also from Project First Line. So if you are looking for any kind of education for infection prevention and control, Project First Line is a great resource, and it's things that you can use with your staff in 10-minute modules, 20-minute modules, or even hour modules. So that's Project First Line. Liz and I also head up that project. So if you need any help, want any train the trainer, we're available. And I will put our contact information in there. And I now see, Kathy, where I can put it to everyone.
Thank you, Cindy. And I'm going to run over some closing notes. So during that time, if anybody else has a question or comment, please submit it using either the chat or the Q&A tool, or you can raise your hand if you would like to request to ask your question out loud. I'd like to again invite everybody to next week's webinar, which will be a live Q&A on enhanced barrier precautions. We talked about those recently and have lots of questions, so we decided we're just going to bring our health panel back and take all of your questions. So if you are interested in joining us, that will be the same time and place next Wednesday at 2 p.m. We invite you to also bring your questions to our virtual live chats every Tuesday and Thursday at noon. One of our quality improvement specialists will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. You can find the links to our live chats and our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you would like to receive that newsletter but don't think you are on the mailing list, you can contact me at qualityinsights.org. I will get you on that list. Now I'm going to drop my email in the chat, and it looks like Cindy has posted hers and Elizabeth's. And I will be emailing everybody later this week to the email address you used to register, sending the slides from today, the links to those videos, and the contact information. So in case you didn't get to take it down and you would like to have that resource, plus a link to the recording. So you'd be able to rewatch this if you would like to. And I'm looking at the chat and I don't see any more questions. So I think I can wrap us up.
There's just one more food for thought during COVID. And so we need, with the aerosol treatments and such, with anything, I guess, if you have like a flu or a COVID and there's aerosol treatments, these can help also to identify how long after an aerosol treatment is done that the room would need to be a person with PPE would need to wear that PPE. So I know that was a big question during COVID as well.
Thank you, Liz. Cindy, did you have anything you want to add before we closed out?
No, I don't think so. I thank you all again for having us.
All right, in that case, I will close this out. Before we sign off, sorry, Liz, were you waving?
I was waving goodbye.
Okay, I was like, thought you were waving like, hold up, I'm not done. Okay, great. I'll get started to sign off then. Before we sign off, I'd like to ask everyone here to please answer a short evaluation of today's webinar. It's anonymous and will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Elizabeth and Cindy, I'd like to thank you both for joining us again and for this great presentation. And we hope to see everybody here sometime again soon.